Good morning, good afternoon, good evening from wherever you're watching us across the globe. Also, depending on what time you get to watch this video. It's another Monday, and that means Parenthood 101 Mondays. How are you guys? Thank you so much for the new subscribers. I love manze. Ni mapenzi, it's all love. And those that have not subscribed, it's still not yet late for you. You can still subscribe, hit that button, and never miss this show because man, our Mondays, we make sure we remove those Monday blues from the Monday. But anyway, so today, delivering a child to when you bring a child on this earth, it brings a lot of changes to the woman, and depending on how she adapts to these changes, it also depends on like whether she will be depressed or not. So today we are talking about something that happens to so many women, but they don't know it actually does happen. But we are here because we have to teach, right? Exactly. So there is a gland called thyroid gland that is situated on your neck just above your collarbone. It's called a thyroid gland. Looks like a butterfly, by the way, and it's responsible for a hormone called thyroxine. Now this hormone, if the gland does not bring about, like it does not give enough, that's when we have hypothyroidism. When it's producing way too much, again, it's a problem. So we have hyperthyroidism. So today on the show, we are talking about hypothyroidism. So let me introduce the people in studio. Karibu Nsema studio tena. Oh my God, yes, in our show. And our clinician is not in today. So let's welcome a guest clinician. She is beautiful. Let's welcome Salome Ndeto. Salimia watu.
Thank you very much. My name is Salome Ndeto. I am a cardiac clinician and I'm happy to be here to discuss all matters pertaining the thyroid gland.
Thank you so much for coming. And our guest today is a friend of mine. She's a wife, a friend, she's a mother, and she will give us details about her hypothyroidism journey. Let's welcome Amina Mude Mohammed.
Thank you for having me. My name is Amina. I am a thyroid warrior, I like to call it, because it's something that I live with it for the rest of my life.
Yeah. So we will just dive right into it.
Yes.
And ask you, what is your story?
Ever since I was born until high school, all the way to when I was in university, I never knew anything called, I knew there was a thyroid gland, but I never knew there's a condition called hypothyroidism or anything of that sort. Yeah. So when I got pregnant, I didn't because I was, first of all, let me take you back. I was 21 years, I'm in campus, you're pregnant, you have a lot to deal with. Why would you worry about, a certain condition that you don't know of? So the first time I experienced, let's say, my first thyroid symptom was when I was 17 weeks pregnant. I had not gone for any clinic because I was like, I'm in school. I was in my 4th year. I have to finish school because I needed to finish classes by December so that by the time I'm having my baby, I can be free from now, done with school. So week 17 comes, I'm healthy, I'm strong, and then I start bleeding. Like, the bleeding that you're getting a miscarriage. And in my head, I was like, this thing is done, like I'm getting a miscarriage. So I get to the hospital, and then they do the normal check. They check the cervix, is intact. They check the heartbeat of the baby, intact. They do blood test. Nothing is wrong with me. I'm bleeding, but I'm okay. My vitals are okay, my pressure, everything. So the doctor told me, we give you bed rest. And that was my first experience of what will be the journey of discovering about hypothyroidism. So during the pregnancy, it's funny that no doctor actually decided to do a thyroid test on me throughout the pregnancy. So I used to have episodes of heavy bleeding, like heavy a lot, that I need to be admitted and then given bed rest. But over from week 17 to around week 38, I used to have like menses, and you're pregnant. And I used to ask them, what is the explanation? Nothing. No one will even give me explanation. So I was like, okay, sawa. So when I gave birth, that was December 29, 2014, normal birth, nothing abnormal with the baby. The weight was expected, underweight, because of course the bleeding, and it was causing a lot of stress. So I get home, I'm a new mom, I'm straight from campus. I had some personal issues to deal with. So I feel like that time in my life I had I was going through, because I was going through a major traumatic situation from giving birth to now. Let me just give a brief. My husband is Christian, I'm Muslim, so my family coming to terms with the fact that I am pregnant, I'm still in school, this man is Christian, he's not going to convert, you have not graduated. That is one aspect of, you know, the whole journey. So that, and then you're a new mom. Nana, you know, you know what it comes. And then the worst part is that I didn't have like my mom to be around me. My mom-in-law by then was a teacher. She couldn't, because I gave birth in December, she couldn't stay with me for long. So I'm here, this baby is crying, I don't know what to do. Then it now started falling, as in I started feeling being depressed. But then again, I didn't notice. I knew about postpartum, so I thought it was
that.
Yeah, but it got to April, 4 months down the line with dealing with postpartum, eating badly, that I was able to, my husband told me, you need to go see a doctor, because there's a day my baby was crying, and then there was a mattress. So I felt like she was irritating me. I carried my baby.
How old was the baby?
4 months.
Okay.
4 to 5 months. I carried her and threw her on the mattress. Like, this thing is irritating me. Like, I used to like refer to her as this thing. So I threw, and then my husband was there. Like, yeah, on the floor. Like, thank God there was a mattress, because she used to, like, you know, 4 months you try and sit up.
Roll.
So, so I threw her there, and then I was okay with that. Then my husband was like, no, we need to go see a doctor. So we go to a certain psychiatry, psychology, not sure, one of those. Then I go there. She tells me, she listens to my story, my symptoms. She tells me, you have major depression.
Yes.
And then I'm like, okay, so what's the treatment? She's like, you need to be admitted right now. I'm like, okay, can I go home, pack my stuff?
Then come back.
Because she needed for me to be admitted. She's like, no. Imagine they had to carry me with an ambulance, and I'm okay, I'm not sick. Mind you, as in sickness, what people think that you need to be carried because you are bleeding or something. No, she told you can't go home. So I was admitted at Aga Khan for some time. They did test, nothing. So eventually I had to change the doctors. So I went to a different doctor, and then the doctor told me, we also need to admit you again. All along, no one, absolutely no one is thinking about thyroid. Myself, I'm not thinking, because my sister has a thyroid problem. I should be able to know.
Yeah, because it's genetic.
But didn't cross my mind. Because for me, I was like, maybe I have so much stress. But I was wondering, am I the first person to get a baby? Am I the first person to go through issues?
So you already hard on yourself.
Yeah, so I was thinking, I can't, am I the only person going through this thing? Then, now the turning point was, fast forward, that was in July. June, I managed to graduate when my baby was 7 months. Then immediately after that, I went into now major depression, because I felt like my classmates who did not get kids were now going back to work. Like, they're working, me, I'm not working, I'm a stay-at-home mom. Then you know what happens when you start living with a man.
Yes.
It's like marriage, you're starting, and then so many things are happening at the same time. So I was admitted at now I was admitted for a month, like a proper hospital. Got diagnosed with bipolar. Wow. And then got the treatment for like a month or so. Then my symptoms became worse, so I had to change a doctor again. Then now that doctor is the one who saved me. Was like, okay, can we check your thyroid? Then they did the thyroid test. They were like, you don't need to take any medication. You actually, your problem is because you have an underlying condition, and your thyroid is the reason why. That was the moment I felt like the world, everything was working for me. Like, I knew there was something wrong. Now I can pinpoint. You know how people like to blame? Now I could say, this is the person who has made me feel like this, and I'm not the problem. So that's how I started now my treatment and learning about thyroid, and to where I am right now.
Oh, wow. And Salome, I'll just go straight to you. I hear like five out of 100 women are suffering from this condition, and they don't even know that it's actually an autoimmune disease, and also the fact that it's genetic. So can we talk about what is this thing?
Okay, so when it comes to the body, we have got different systems in the body, and one of the most important systems is actually the endocrine system. So unfortunately, most of us don't really understand what thyroid gland is. So remember, a gland is anything that is able, it's actually part of the body that is able to produce or secrete a certain type of, now in this case we are talking about a hormone. So when it comes to the thyroid, it is an endocrine type of a gland that is able to secrete, now it's able to secrete the T3s and the T4 hormones. Now remember, when it comes to this type of a gland, we need those hormones to be able to function in our bodies. And now when the thyroid gland is not working as expected, when it is underworking, we talk about hypothyroidism. And when it is now overworking, we talk about hyperthyroidism. So we have signs and symptoms. Unfortunately, when it comes to the symptoms, they tend to be very lenient on early stages. So we tend to overlook them. But if you are able to walk into a proper facility and able to pick up those symptoms, it will be easy for us to diagnose you early and to start your treatment early. Like for example, when it comes to hyperthyroidism, we have very classical symptoms. So a patient will walk in and tell you, I'm having palpitations. Palpitations is actually when your heart is really pounding. At the same time, they'll tell you, I'm having irregular heartbeat. They'll tell you, I'm adding a lot of weight. They'll actually tell you, I'm losing weight and yet I'm not dieting. They'll tell you, I'm having anxiety. They'll tell you, I'm having panic. They'll actually tell you that I'm moody. I tend to get angry so fast for no good reasons. Now, when we get all those symptoms, we are able now to send you to the right type of lab test to do. So like in her case, no one picked that at an early stage because these are routine checks. Ideally, we are supposed to do these routine checks. If you're able to do thyroid function test, it's a very simple test. It's exactly, because remember, even there are patients who are hypertensive, they're having high blood pressure, they're on treatment, the right treatment, but unfortunately, their pressure is not lowering down. So thyroid function test is one of the simple tests which you're able to do at an early stage, pick a disease at an early stage, and you're able to help out the patient. Now, like what she was talking about, she was stressed out, completely stressed out, having mood swings, because remember of those lifestyle, transitions from being a parent at an early stage. And with all those symptoms, definitely she was having an issue with the thyroid. And also remember, we have the genetic factors. So like, let's say if one of my family members, either in external or just your immediate family member, if one of them have got any type of now thyroid disease, either hyperthyroidism or hypothyroidism, definitely you are predisposed. Again, when it comes to thyroid diseases, they are very common with females of reproductive age. So that's something which, if she went to the hospital, and definitely I'm aware that she is of that age, I should have done that test as soon as possible. It's always easy when you screen out, because to be honest, thyroid diseases, unless you have a goiter, you'd hardly pick them. And that's the reason why she was taken to a psychologist. Because today you're happy, tomorrow you're moody, you're so angered for no good reason. And it is so easy to pick these thyroid diseases.
So thyroid is basically the hormone responsible for metabolism as well, and also mentation, your thought process, also your movement, and also you could actually gain weight that I didn't know. And Amina, this is where you come in, because you added a lot of weight, and guys were looking at you like, okay, nini ama ni kuzaa. To you, what did you think when you were seeing the scale? Ukikanyaga hivi and then utaanza kujiekea, okay, ni depression. But then there's this underlying factor, your sister has it. And then you also are scared that your daughter might probably be predisposed. That's what you call it, right? So when you saw the scale, ukikanyaga hivi, and for you even to make that intention of, listen, I need to work on my weight, please take us through that journey.
So with my weight journey, and because my weight journey is just because of a thyroid problem.
Yeah.
before pregnancy, I was always the person who will eat. You know, the person in the room who will eat everything and never add weight.
Yeah.
I was always comfortable in my skin. Then I give birth, I stay home. First of all, I don't know, I'm still yet to find out, maybe the doctor can help me here. I was not able to produce breast milk. I was not breastfeeding my child. So that contributed to the fact that I was not maybe connected to I don't know. So that I used to eating as if I'm breastfeeding and I'm not breastfeeding.
Because there's nothing
yes,
coming out.
and then I'm just at home. So I used to eat badly, first of all. The second part, and this is a very psychological thing that happened to me. When I discovered I had a thyroid problem, number one, Google thyroid, they tell you, you cannot lose. It's hard or it's next to zero to lose weight. So in my head, for a better part, for like 3 years of my life, I knew I can't lose weight.
Yeah.
It was a struggle. And I used to tell my friends, when you eat a hot dog next to me, when I breathe it, I'm going to add weight on your behalf. It was that bad because every year I used to feel like I'm looking at my diet. I'm not eating a lot, but I'm becoming big. Yeah. Big and big to a point that, and you know what that means? It gives you self-esteem issues. And that compounded with the fact that you already have mood disorders, it was like a room for me to just eat badly, so to say, and not like look at myself, I'm like, I'm already big, I have a thyroid problem, so why should I care? Yeah. So now the turning point happened when I knew I wanted to conceive a second born baby, but I used to, that time I was 93 kgs. I'm like, if I get pregnant again, I'm going to be 150 kgs. Yeah. But my heart was desiring to get another baby. So I said, let me do this. During this 9 months of pregnancy, I am going to go in and read and do research on my own every single day of my life, find out what is it that I'm not doing.
So what was the breakthrough for you?
For me, the most important information that helped me to change the whole script when it comes to my weight loss and my health in general was that I discovered that I'm not like you, Nana. Yeah. Neither am I like you. I'm special. And in that, I need special information. I need to deal. I can't go with you to the gym and do the same thing. Neither can I eat the same food. I needed to go back and understand how my body, as a thyroid patient, how am I supposed to eat? Yes. How am I supposed to sleep? How am I supposed to function? Get to the root cause, understand it, understand that this is my body. Then I worked from behind. Then I got slowly by slowly. And then, you know, the moment you try something, you discover this is not working for me, this is working for me. And then at the end of the day, I think I'm here. I managed to lose, right now I'm 73 kgs. My highest weight was 110. That's 37 kgs. And it has been a journey. And for me, I say the weight is just a number that people see, but people don't see the knowledge or the struggle or the understanding that I went through.
Yeah. But I saw one of the symptoms was actually when you have the thyroid. The thyroid also is supposed to regulate your body temperature. So I don't know how that works. Daktari, you can slide in.
Now, when it comes to the thyroid gland, it is actually the reason why it metabolizes everything. Like what she has just told you, she was adding weight for no good reason. And then again, because of adding lots of weight, she decided, okay, fine, I'm still adding weight. Let me just have, poor feeding habits. So when it comes to hypothyroidism, the metabolic rate is actually reduced. Now, in this case, you are going to add lots of weight, and yet you are not feeding as much. So remember, your self-esteem part of it is going to be affected. So definitely when someone, most of us, when we add a weight, we tend to have very low self-esteem. So we think, okay, let me just eat because at the end of the day, I'm still overweight. And now when it comes to hyperthyroidism, because now the thyroid is really overworking and producing a lot of its hormones, which are not really actually required in the body, they tend to lose lots of weight. So someone will tell you, I'm losing a lot of weight despite me not being on any diet. They'll tell you I'm having heat intolerance. And when it comes to heat intolerance, it's very simple. Someone will tell you, I can't cook in my house when the doors are closed. I have to open the doors, I have to open the windows. I can't just tolerate heat. So they'll tell you, every time I'm cooking, I'm having these severe headaches. I'm actually having these severe palpitations. I'm just feeling so unwell, and I feel a lot of dizziness. I feel like I don't want to cook. So that is actually the part which brings about a heat intolerance. Someone will tell you, I'm really sweating a lot. It's early in the morning, it's a bit very cold, and I'm really sweating a lot. And to justify this type of sweating, they'll tell you, I'm having clumsy arms. My hands are just wet. They're always wet. I need to have a towel. I feel very uncomfortable greeting people because my hands tends to be very clumsy. So when it comes to that, you will be able to pick and send the right test for them to be able to know whether it's hyper or hypothyroidism. Because remember, these are extremes. So when it comes to hypo, they'll tell you, I'm having cold issues. I'm feeling it's extremely cold, like it's very cold for no good reason. I'm adding lots of weight. I'm becoming moody. I'm losing hair. My nails are very brittle. And I'm just having sleep issues. I'm not able to sleep. I'm not able to rest. I'm very anxious. So we tend to have the extremes. And that's why you'll find most of the patients are going to be misdiagnosed. And they'll end up to a psychologist despite not doing the test in the right way. So when it comes to the treatment, if you are put on the right treatment, the correct dosages, because ideally you should be on follow-up, if possible every month, because we need either to increase your dose or even reduce your dosages, depending on how we are following you up on the results, your test results. So we need to adjust your treatment accordingly. We need to teach you the right diet. Like we are always advised, you need to avoid gluten. Yeah, we try as much as possible to advise our clients, our patients, just to reduce on the gluten, and also to avoid soya. Any soya product, we tend to tell them to avoid them. They just need to do a proper diet and avoid the two things that were actually mentioned. So once we are able to pick the right dosage for you, definitely we'll have now to work on losing the weight. So when it comes to the issues, just like what I was saying, the weight is not the problem. The problem is actually the thyroid, because it's not working as expected. It's actually underworking. And in return, we have talked about the metabolic rates being very low, and hence someone topping up lots of weight for no good reasons. So we have got the factors that can make someone be predisposed to that. So one, the fact that someone is a female of a reproductive age, it tends to be it's actually a predisposing factor.
So it doesn't affect men?
It tends to affect men, but the higher percentage is actually on women. So number two, if someone is having chronic illness like hypertension, they need to be checked on their thyroid levels. Number three, when it comes to genetics, just like what we said, if you have a relative who has a history of it, then definitely you are going to be predisposed. At the same time, if someone is having some growth, the commonest is actually goiter. So if someone has goiter, definitely it's going to affect the functionality of the thyroid gland.
But Amina, you did a lot of research concerning this condition. What worked for you when it comes to nutrition?
For me, it was not just nutrition, it was a 360 approach. It started with food. Food is like, for me, the reason why I'm healthy now, I'll say. So I had to eliminate food groups just the same way the doctor has said, plus also do intermittent fasting. That's not eating for a period of hours and then eating. And then also just not only what the doctor gave me as the treatment, the levothyroxine, I went ahead to do more research and I started taking supplements. I take selenium. It's good. It's one of the best supplements for your thyroid. I take zinc for my thyroid also. And the fact, I forgot to mention, when we have, there's hypothyroidism, but when the hypothyroidism is caused by it's an autoimmune, when your immunity fights the thyroid, so it's called Hashimoto. So for me, I not only have hypothyroidism, I have Hashimoto's. So when it comes to Hashimoto's, my approach will be different. So I take zinc for my immunity, I take magnesium for my moods. So I not only just eat foods, I try and supplement what I can't eat. And then I also work out for my mental clarity, because I notice, or if I stay 2 days without taking my medication, I'm back in that place where my typical number one point that I know my meds are not working or my thyroid is not okay is when I don't feel like leaving the room. I want to stay in a dark place. And that takes me back to something that I forgot, an interesting thing that happened to me. So part of when I was in and out of hospital, not knowing what I have or something of that sort, there's one doctor who gave me Strattera. From bipolar, they told me I have ADHD, attention deficit hyperactive disorder. So the part of the treatment was taking Strattera, if I'm not wrong there. So I was at home, I took the Strattera, but in hindsight, that Strattera it makes someone with thyroid, their symptoms worse. So I got it to a very bad place. Let me tell you, there's a day I think I took the medication for 3 days. There's the 4th day I stayed in the room. I was not leaving. And I'm saying this story and my heart is like, because I feel like I'm reliving that moment. I went upstairs to my room. I was not leaving. I was not functioning well. I was like depressed, like that dark place where you feel like you're hopeless. Then it was my time to take medication. I remember my husband used to call me to remind me, because when you're depressed, you forget things or you don't see the need why you need to take medication. So he calls me, he tells me it's your time to take medication. So I take 1 tablet. Then I swear I can't tell you what happened in my head. I ended up taking the whole, it was like 15 tablets. That's an overdose. It's like for someone who's outside, they'll say I was trying to suicide, but come to think of it, it's actually suicide. So I took the medication. I was in bed. I started feeling as if my throat, my airway was locking up. So I couldn't breathe. And that point, I'm in bed. I knew I needed to open the door and go and call out for help, but the depressed human in me will not allow me. So I stayed, and then I think I was a bit unconscious, because there are parts of my story of my life that I forget. I don't know. Part of, I think, therapy, what I was taught later, is that you become forgetful. So the good thing how God works in mysterious is a neighbor comes to see me just to say hi. Then my nanny is like, she's upstairs. Then she comes in. I was like forming. You know how you form and get, because I had taken an overdose. The next thing, they carry me, they take me to hospital. So by that time I was living along Mombasa Road. So they took me to Avenue. It was like the closest. Then when I got there, it was almost 7, so it was an outpatient facility. They couldn't help me. So what they did, they gave me charcoal to try and pump out so when I got to at least the charcoal helped me to be a bit aware of the situation. So the first thing, when I got to Mata, they called because they asked history. They found out that this is a person who has depression and all that. So they called my doctor. So let me tell you, the turning point in my life, I was seated reception as you wait for people to, it wasn't really reception, it was like after reception, when because it was a sort of emergency, but I had not seen a doctor. And then that time there was a bad accident that had happened along Mombasa Road, just outside Standard Group. And I remember that time a few people had passed on. So I remember I was sitting here. I'm from saying my life is pathetic. There's a lady who was being wheeled in, who was pregnant and had passed on, and they had covered her. So they were bringing in bodies, so they had to like wait for me. Like I wasn't emergency that bad compared to the people who were coming in with cats. And so I was seated there. My doctor came in. She's like, Amina, there's only so much that I can help you with. I can only help you with what I can tell you. You have to pull yourself from that place. She held my hand, and I every time I think about that doctor, I'm like, God bless her soul. She told me, look at this lady. She's expectant. There's a baby in her tummy. She will have wished to be here. You're there taking, trying to take your life. What does it mean? She told me, don't ever come to my office again if you really don't want to work on yourself. And I felt like when I went home, remembering how there were people there who would have wished to have my life, I just went home, went to see the doctor, and then started the healing process. And trust me, the healing process is worse than being sick, because you have to deal with your demons. You have to do a lot of work. You have to look around, and everyone around you, needs therapy, because the damage, I have a husband. He was with me throughout the journey. He needed to understand what is thyroid. He needed to understand. Even today, there are days I'm moody because I'm having PMS. Then he's asking me, have you taken your medication? Yeah, he doesn't know. Then there are days he even counts my medicine, 7 days, Monday. Then he'll come and tell me, last week I put 7 tablets. Why is it 5? You took 5, you didn't take 2. There are 2 tablets. You see, it requires people around you to understand you and to be there to support you, because even today, Nana, I'm not lying to you, last week I had an infection and then I was taking strong antibiotics, so I decided not to take my medicine.
Because you're scared of overworking.
Yeah, because I feel like let me tell you, I take so many medicines. In the morning I take 2, I take some other 2, at night I take 2. So I was thinking, I'm already taking 6 tablets. Why should I add? That whole week, I swear I was not going to work, and people don't understand. I'm not picking people's calls, and it's not me. And that's the thing that I wish to educate women and people, is that sometimes it's not the person, it's not them deciding, it's not their problem. Life has problem. It's not their problem. It's what is their body is set up against them. Your body is not working for you. And that's the point where you need doctors, you need to understand your condition, you need to have an open mind, you need a support system, because I wish I had someone like me who will tell me, by the way, don't do A, B, and C, do like this.
Yes.
Yeah.
Daktari, tuambie, tunaenda kumaliza show, and I feel like that topic is really heavy. Like, I can imagine so many women going through this, the 5 out of 100 that are actually probably in the midst of us, and we don't even know. They don't know. They're looking at Amina right now and they're thinking, my God, I have those symptoms. What would you tell them?
When it comes to treatment, it has to be a holistic approach. Because remember, thyroid issues tend to affect lots of systems in our body, in terms of our psychological part of it, in terms of our diet part of it, in terms of actually also hormonal part of it. And that's why she was talking about bleeding during pregnancy. So when it comes to management, it's not all about just taking the tablets. It is having a holistic approach. Remember, when these people are moody, when these people are having all of these episodes, they're actually in an enclosed environment. And in this case, we are talking about a family setup. So when it comes to treatment, it is always good to bring in other members of the family, that is actually a spouse or even their children, so that they are able to be educated on when this person is having this type of moods, they need to understand what is happening. And also it comes to patient education. They need to understand why are they taking the medication. Because at the end of the day, if it's actually an autoimmune disease, definitely it's there to stay. And we need to manage it. We need to change your lifestyle. We need to make your life better. So you will be able to understand why you're being told you need not to skip your medicines. You need to understand why you're being told you need to be on that treatment for the rest of your life. So when it comes to treatment, it is easy when you do it in a holistic approach. Then when it comes to the part of depression, definitely we have treatment on that. So we will be able to combine the part of depression. We'll be able to combine the part of hormonal imbalance. We'll be able to combine everything, including family, psychology, and that they are able to guide you through. They're able to push you up to take your medicines. They're able to support you. They're able to accompany you for checkups. But apart from that, you need to follow up when it comes to your lab investigations. You need to do at least every year. Kindly just do your thyroid levels. We need to know whether we need to reduce the dosage or to increase the dosage.
Hata sikuwa najua hiyo kitu until I started reading, and when she told me about it, I didn't know it was as bad as it is right now, getting all these stories. But Amina, I just want to know, like, you know how to test, self-test nyumbani. Kindly show our viewers.
If you're at home and you think that you might have a thyroid problem, the most blood work is the most recommended, and a CT scan. But if and a scan, so what you can do, just take water, any liquid. I'll take it, and then you watch my thyroid gland, which is here. It's like butterfly shaped. Yeah. So since I have a thyroid problem, we'll compare it with Nana. You'll see mine, then Nana will do, so that you can see. If you see any swelling around your thyroid, just go get your blood work done. So I'm going to sip some water. and you can hear the sound of me because it affects even my voice box. But there are days I can't, I feel like I have a hoarse voice. So if you can see any swelling, just go see your doctor and get your levels checked. For comparison,
my director is over there telling me how I should do it, so let me try it. Okay, I don't know if I have, but of course, let's see. Did you guys see it?
You're good.
Yeah?
You're good.
Oh yeah?
Yes, you are. And also another way of just checking it, you just need to palpate your neck. You can always tell when you're having a nodule. And once you feel something like a swelling, just come to the hospital. They'll be able to check you out, do an ultrasound, and confirm whether there's actually a nodule there.
It's better to be safe than sorry, right? Thank you so much for all this. Thank you for all these gems of knowledge that you've spat today, you guys. Asanteni sana, you've helped so many women, but that is all that we had for you today. But wase cheki, kama uja subscribe na umewachi kitu yote unadu, cheki hit your button na pia weke hiyo bell, ndio next time sele tunafanya hizi inaitangwa premiere, uko to your notification, gangs. Anyway, if you also have any product that you want us to amplify and it resonates with the women and the people that we serve every Monday here, please do get in touch with us. And also, thank you so much to this set, Kaka Empire Studios, asante sana, the crew. Thank you so much. So until next time, guys, please subscribe, like, share, comment, and I love you.